So this lecture is on developmental play assessment and teaching, and this comes from the Effective Practices book, chapter 14. So I think maybe this isn't something that we do too often as teachers. I think it's something important to know about and to have knowledge of, but it's not necessarily something you would be expected to do as a teacher without training. So, for a quick introduction, I don't think any of this is going to come as a surprise, but play provides context for learning for children, and developments in play contribute to developments in language and social understanding. And then children who have difficulty learning overall often also have difficulty learning how to play, which is why we often have to directly teach these social skills and these play skills. So when we go to teach play, it includes looking at both what to teach and then also how to teach it. Okay, so there are three main types of play interventions that we're going to talk about. So the first one is play as a pro-social activity of childhood. And so this approach considers play as the natural activity of childhood, and it's based on what children do, and it includes attention to toys and activities of their culture. So using a variety of appealing toys, and then directly teaching a variety of play activities with these toys or within a specific area. So sometimes it can also involve teaching different play scripts. And then some of the limitations of this approach is obviously the limited generalization. And then some children exhibit exact replicas of what they've been taught. So they perform a series of activities versus understanding how to play. So if you were using play scripts, which is basically they learn a script of how to interact with a certain toy. So there might be certain things that they're expected to say while they play with the toy. And so they might just replicate what they've been taught, but they're not necessarily learning how to play. Another approach to teaching play are play interventions based on broad categories of play. And so these different play categories come from child development literature, and they include symbolic play, play scripts, and the sociodramatic play. And some of the limitations include that the categories might be too broad. So if the categories are too broad, then there might be many different levels of developmental complexity, making it difficult to decide what to teach. And then there can be many subcategories within. So you can see table 14.1 on page 306. It provides an overview of some of the play interventions based on broad categorical descriptions of play. And then the third approach to interventions in play for children with autism is based on regarding play in terms of specific developmental sequence categories, representing developmentally ordered components of the broad categories of play. So this is more specific than the last one, which included just the broad categories. And this gives you more finely tuned categories of exactly what to teach. There are procedures based on assessment, so that you can determine a child's progress in the play development and teach developmentally appropriate play. And these finely tuned categories give you more specifics for what to teach within a play intervention. So when we look at play as a developmental domain, there are two main bases. There's the theoretical base and the empirical base. And so understanding both of these allows for assessment of play when identifying what to teach children with autism, and then it also informs us on how to teach or the procedures we would use to teach them. So we're going to talk about more about both of these two developmental domains on the next slides. Okay, so when we look at the theoretical base for play as a developmental domain, we can see that play contributes to expressive language and learning based in cognitive developmental literature. Another important factor is that play serves an interpretive function in development, and this is based on Montessori's view of play as child's work. And then Lifter and Bloom, this was talked about in the chapter, and they say that play shows what a child already knows and what a child is thinking about in order to learn. Then there's also this empirical base for play as a developmental domain. So this is where researchers looked at different research. They looked at descriptive studies of the play of children developing with and without disabilities to look at the progress in their development. So they looked at how typically developing children play and how they develop and how children with disabilities play. And then they also looked at descriptive studies that provide evidence for systemic relationships between developments in play and developments in other domains, such as language and social development. So we know that play can have an effect on these different areas, and so they kind of looked at some of these descriptive studies that show that. So when we look at the play of children without disabilities, we find that there is this general developmental course that they take to develop these play skills. So if you have kids or if you've been around kids, I mean, you kind of know and are aware of some of these different developmental levels. So infants, they start playing with objects. They might be grasping objects, picking them up, dropping them, putting them in their mouth, taking them apart, and then once they are around 1 year old, then they can start to put these things back together. They can move around from place to place, and they demonstrate knowledge of how these toys work and can interact with these toys. Early toddlers, they might like to stack cups, relate objects to self, like pretending to drink out of cups. And then they might do other pretend activities. A lot of times at this age, they're playing with fake food, they're making meals for you. They can swap out one object for another. And then preschool age, they start to do more sociodramatic and fantasy play, and they can interact with others their age, and so on and so forth. And then also, as you know, that the play of children with developmental disabilities is different from the play of typically developing children. And so some of that play for children with autism can be that they might not play or interact in play activities as often as typically developing children. And they might not engage in a variety of play activities. They might be fixated on only playing with certain types of toys, like they only play with a certain train or a certain truck or a dinosaur, and that is the only thing that they want to play with, and they don't want you to interact with them while you play with it. They might spin parts of a wheel or open and close something constantly, so their frequency of play activities and their variety of play activities is not as much as typically developing peers. And then their pretend play is basically almost non-existent. They often can't engage in pretend play. And when they interact with others, it's often more of a parallel play. They're not actually interacting with the other child that's near them. So the developmental play assessment is one tool that we can use to figure out what to teach, what play skills to teach children with autism or children with developmental delays. So this assessment is going to be more appropriate for young children, like preschool aged, maybe young elementary age students. But it's an assessment instrument used to link developmental assessment into teaching play interventions for young children. So we might observe the child and use this assessment to figure out what exactly that we should teach them. So the procedures are there's a qualitative aspect, and qualitative often means it's more of like descriptive. So quantitative talks about it's more like data based. Where qualitative, if we're going to observe the child, we might talk about the quality of their interaction. Or sometimes we use interviews. That's another way that we would get sort of qualitative data. But really, in this, it's the developmental readiness to learn qualitatively different categories of play activities And then also part of the developmental assessment is the quantitative procedures. So it looks at criteria for each category based on the frequency of activities. So there are 3 different sort of scores you can get. There's mastery, which requires a minimum frequency of 10 activities. And then there's emergence or absence, and so these require fewer frequencies of activities. And so Table 14.2 and Table 14.3, which these start on page 311, they give you an idea of sequence and definitions of these play categories that are used in the developmental play assessment. And then Table 14.3 shows you example results of 3 children with PDD NOS. So the last thing we're going to talk about is linking developmental assessment to teaching, and so we're going to look at how we teach. So there's 3 different types of child-directed interventions we're going to talk about. So the first is child-directed interventions based on interest. So for this, you're just going to build on the child's interest. So whatever the child is interested in terms of toys, that's what you're going to use. If they move towards an object, you're going to use that object. So you're really going to build on whatever they are attending to at the moment and what they're interested in. So this sort of relates a lot to the naturalistic teaching that we've talked about, and those types of procedures, because the child is more directing their learning. And then another type is a child-directed intervention based on their readiness to learn. And so this is an extension of child-directed interventions, and it's derived from the developmental assessment that you conducted. So what you teach is child-directed if it's based on the child's level of understanding. And so we know that children without disabilities often direct their learning, which we can see in the different activities they choose to play with. So they move around, they pick kind of what they want to play with, and that kind of guides their learning. But children with developmental disabilities often have difficulty learning to play because they have difficulty learning. So they don't direct their learning in the same ways that children without disabilities do. So the selection of what to teach children based on this developmental assessment helps to support their capacity to learn. So you would want to identify activities at the level where understanding is emerging, and then this increases the child's chances of actively engaging in learning. And the last thing we're going to talk about is the child-directed teaching methods, which is another way to look at how to teach play. And so with this method, it should include attention to both interest and ready to learn. So it kind of combines the last 2 methods that we talked about. And so for all of the target activities, they're going to be determined to be at the emerging or next step level based on that developmental assessment that you did. And the teaching opportunities occur when the child is looking at or touching an object, and that's how you kind of build on the child's attention and interest in the object. And then the teachers during this time describe what the child is doing, and if the child attends to the target object and attempts the target activity, then the teachers would use the least to most prompt to support completion of the attempted target activity. So this sort of sums up the developmental play assessment. So it's a little bit different than a lot of the other things we've talked about. It's really kind of looking at play as learning and sort of how to develop these play skills.